Having been a commissioner for rare disease and highly specialised services in my past career, my sense of their valuable contribution to learning about rare diseases, to ensure that science evolves as well as understanding evolves for the benefit of the patients is really important. And I think that using these infrastructures to develop that and then be able to sing about UK PLC and what that can offer the research landscape is really important.
People are valuable, everybody is valuable, and people who live with rare disease, you have family members with rare disease, are often very familiar with really not having their problems or their issues taken seriously or recognised. And I think we have to value people. I think there are also really important opportunities around making care better in general, better clinical practice. So this is a win-win for everybody.
Well, without a rare disease or highly specialised service, we're never really going to learn how to improve the care of patients with rare diseases. If a patient with a rare disease is seen in a hospital that sees that disease maybe once every 5 years, you're just not going to learn from your mistakes. Whereas if they're focused into single centres, then the specialist looking after them gains a much better knowledge of how to manage the disease. Data can be collected, one can learn from one's mistakes and develop future treatments that are hopefully going to transform the lives of patients and their families.
As a mother of an adult son living with a rare condition, I can't tell you the impact of having a highly specialised service as the positive impact that's had on me and my family. I think, it's really important that we recognise how challenging it can be to live with a rare condition, and through the efforts that people have made within the rare disease community to bring together that coordination of care, to develop an understanding of rare conditions, and the fact that, there is no one size fits all in terms of services for people with rare conditions. We need to adapt to meet the individual needs of families, and I think that's what's really important when we're developing these services, that we recognise some of the unique features of living with these rare conditions, and we need to adapt and make sure that we're providing the most appropriate care, support and hopefully treatments along the way.
When I was coming today, I started to think about flipping the way we normally think about rare diseases and thinking of them as potential exemplars, where you have committed networks of patients, researchers, clinicians who are really focused on areas, who can make profound breakthroughs both in drugs but also in how we deliver care. And so I think they're a really potentially exciting way of seeing what the future of medicine can be today.
I think these are really important for the 6% of the population that have these diseases and often overlooked by the health service, who are thinking about knee operations, heart disease, cancer, etc. as well. It's a very diverse patient group that don't get such easy access to healthcare, often because multiple parts of the body are affected as well. And the health service isn't really geared up to deal with patients with rare diseases. So I think it's really important to flag up how important these are, but also to explore new ways of delivering services in the National Health Service, especially in a time when we're quite short of resources to do so.
So we really need to keep the patient focus in rare disease, and as with all specialties, but in rare disease it's just even more important because of the journeys that these people have to not being understood. They are not understood, they have a very difficult journey. It's so important to focus our attention and needs on their needs.
Rare diseases are complex, and a lot of it is unknown, and it needs a systemic way of addressing the problem when confronted with a patient with some sort of rare condition. The highly specialised services really are a very powerful mechanism to assist patients. In the Behçet's community, we're very fortunate to have 3 of them, one in Liverpool, one in Birmingham and one in London. But I'm also very conscious that there are issues with the devolved nations and indeed patients within England who don't actually attend the highly specialised service. But they are most valuable in really fundamentally understanding rare diseases most thoroughly.